a while back. So I enjoyed it. Great. We lived in Edmond, and then moved back. I never really felt like it.
And they need nurses.
Until the Optimus robots. Yeah. Oh yeah. It works. Yeah, but I had to do a thought about it. You guys know everybody? Christopher, I'm Rob. How does one become student of the month? And we make them speak. We'll probably the guy who runs travel a lot. My company's actually based in Washington, so oh, you just did your rent? I did, yeah. It is a data science / architecture.
Okay. I don't know.
got a very common line that I already gone and got to the edge. So we're up. She said, why don't someone else? You need to not get yeah, she is away from you to get to know her. Yeah, saying she's had an investor relations talent here. Very, very well. She was in Austin. Everything got it. Okay. She says it the same way you do.
Our Rotary meeting on January 22nd. We are glad you're here. Glad to see a full room with some new faces. We are always happy to have guests join us. So we're going to take a quick moment to pray, meditate, just a moment of silence. Okay. Our flag salute today is with Chris Wilson and four-way test, Teresa Collado.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Things we think, say, or do. First, is it the truth? Second,
is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Thank you. You can have seated. Okay. Just a reminder that we do record our meetings. They're on our YouTube channel, which is Norman Rotary Club. So smile. Okay, we have some guests today. Steve Wood, we'll start with you.
Yes, I have. I'll scream. I have with me today Matt Miller that works with me at the health department.
Okay, and hey, do you want to introduce your guest now or when you introduce the speaker?
Angela Harden with the Boyd College of Public Health is here.
Thank you, Angela. And Pat Martin, our esteemed fellow Rotarian from the Purcell Club. We're glad to hear or see you here, and I think you have something you would like to share with us.
Welcome, Pat.
Yeah, of course. I appreciate taking a minute or two of your time. I am from the Purcell Rotary Club, and many of you have come down for years for our chili luncheon and silent auction. And so it is February 4th, same place, Methodist Church, which is, we've been there for 104 years with the ladies of the church cooking for us. They do not cook our chili. We have 3 or 4 chili chefs, And the school helps us out by cooking our meat. And it's an amazing thing to see when you put several hundred pounds of meat in this, and it rolls it, and then they rinse it with hot water, so there is no fat in our chili, fat-free. So if you're worried about that, come on down. We will have some wonderful things for the auction, and if anybody knows that they want to come, if they will give me their name before they leave, I will leave it there. I didn't bring any tickets, but I will leave their name at the door, and you can get a $10 ticket rather than the walk-in price of $12. Save you a little money. I know a couple of the things we're going to have. We have a couple of really nice Airbnbs, both in the woods, but you can get out for Joe's Pizza there in Purcell. So that will be one of the auction prices or gifts. And then we have a Williams and Sonoma basket with just overflowing. And then one of the things we're doing this year that we haven't done for a while, and I will be the chef. Several other Rotarians will be helping. It will be a dinner in your home or whatever place you choose. And it will be Mardi Gras, and it's after Mardi Gras, it will be Welcome to New Orleans with jambalaya and salad and bread, banana fosters for dessert, and 3 appetizers. So that's always a fun thing, and 2 of you can go together, and then each invite another couple. So please come down. We love to see y'all come down. Thank you.
A couple of us went last year. Good chili, good auction items, so it's not that far south. So it's great to support our other fellow clubs in the district. Okay, we do have a student of the month with us today. Rob Andrew is going to introduce her.
All right, so it's my pleasure. She has been here one other time before, but we have a student of the month from Norman High, Sophia Olivares. And so she already talked a little bit last time, but this time I've asked her to talk a little bit about her background, where she's from, and how she found out about Rotary, Interact, and what she thinks of her club so far. So here you go. Welcome.
Thank you. Hello everyone, my name is Sophia. Thank you guys for having me. This is my second meeting. And I just want to talk about my family background first. So my parents, they were born in Guatemala, and I've lived in Norman for my whole life. So I will be a first-generation student to attend the University of Oklahoma this fall. So I'm really excited. I've been to Guatemala many times. I hope I get to come back this year and see my family there. And then how I found about Rotaries, I've been in my high school's club for the last 4 years. And this year's, there was a scholarship application. I applied, and thankfully I got chosen to be January Student of the Month. And it's been wonderful to see how much Rotary impacts the community. I love volunteering, and so it's always helped me make more connections. And yeah, well, thank you guys for having me.
Thank you, welcome. Okay. I gotta look or I'm gonna forget. Okay, just a couple of announcements from me and then another from Craig. Just an update on Dennis Brigham. Things are looking better. They're looking at transferring him, they were hoping maybe this week, to a long-term acute care facility that specializes in strokes, brain trauma, that kind of thing, for occupational therapy. There is a GoFundMe set up, and there's also a meal train set up, and we can give you access to those if you are interested in that. I know that a couple weeks ago when we did an ask for gift cards, we had $400 in gift cards that we took to them for local restaurants, which was very helpful. They were very appreciative of that. And Beth has asked me to remind you several times how grateful they are for the Rotary family. So just a little update on that. After hours is tonight. It's usually the third Thursday, I think, but it's tonight at Billy Goat Grub. That's on Main Street from 5 to 7. You don't have to be a member of Rotary to come. It's just a social hour. There's no program. It's just talking, get to know your fellow Rotarians and friends. So everyone is welcome there. My last announcement is that we have Storypalooza sponsorship folders. They were on your tables last week, the sponsorship list. But we have folders. If there is someone that you would like to approach and you feel like a hard copy is something that is better to hand to them, help yourself on the way out. The forms are available on our normanrotary.org website, and there's a Storypalooza page. So you can access the donation forms there as well as the information form. You can create whatever you want digitally to send if you would prefer to use that method. But we encourage you to seek out sponsorships to make this a very successful event. Okay, that's all my announcements. Craig?
Okay, I'm over here. Yes, next week I sent out a sign-up genius for last Friday, I think, if I'm right, for the Rotary Success Cycle. I've got 2 schools I need covered next Friday, and I can't go because I've got a meeting thing I have to be at. One is Madison. I can't remember the other one, and I was going to look before I got here, but I got tied up. So next week, there's 2 schools we need to be covered, and so if you look, I know Madison's one of them, if you look at whatever the other one is, you can get that. You're doing it? Okay, thanks. Okay, you're doing Madison? Okay, perfect. I appreciate that. And then the other thing is, why don't you come spend Valentine's weekend with me? That sounds like a lot of fun, doesn't it? All right, we're doing a book fair at Barnes & Noble on Valentine's Day weekend. And I know you'd love to be with me on Valentine's Day weekend because I'd love to be with you too. So I'm going to send out a sign-up genius about that here in the next, a week or so before, and we'll be doing that too. And it's a big fundraiser, obviously, for Rotary Success Cycle and Platinum Notes. Thanks.
Thank you. For those of you who are newer to our club, what we do is we go to schools at their assembly, and kids who have qualified for reading, they've met their reading goals, they're entered into a drawing, and then they can receive either a gift card for a book. I'm sorry, a book. We don't do gift cards anymore. I don't know where that came from. They can receive a book, or they can receive an e-reader. And it is a lot of fun to hand those to a kid who's so excited about receiving that. And in some cases, it may be the only book or the only opportunity they have to have something at home that they can read. So seeing the joy on their faces when they get that, it's worth getting up at whatever early hour in the morning and getting to an elementary school. So I encourage you to sign up, especially if you're new. Go check out what that's about. Okay, last thing from me. Bill, ready?
Madam President, it's like every week somebody's getting Paul Harris Fellows. I'm very impressed with the continuous giving of this club. Hank Hartzell, you are one of those that just continue to do that. We thank you very much. The money that he gives, I want you to remember that half of it goes to the district, which can be our club. Half of it goes international. I'm an international guy. I love the projects all around the world. I've seen them in Guatemala projects, Rotary projects there, many of those. That's one place. But last year, over almost 500 district grants were given out by the Rotary Foundation. That goes locally. And do we have anything going this year? Have we applied for anything?
We have our water project locally that's continuing, and then we have got a district grant for our book vending machine.
District grant for the book vending machine. So that's where some of this money goes. So Hank, congratulations and thank you for your support of the Rotary Foundation.
Awesome, thank you. Thank you to everyone who continues to donate to the foundation. Okay. Well, I shouldn't have probably let Hank sit down. Do we have a road pass shop? No, okay. Well, Hank, come back up. Hank is going to introduce our guest speaker for today.
Good afternoon. I'm proud to introduce Sara. Sara's a faculty member at the College of Public Health with primary teaching responsibilities with the undergraduate community health and public health programs. These growing programs are relatively new to the university, and I think you'll be interested to hear about them. Additionally, Sara King was a member of the leadership team for the COVID emergency response at Cleveland County Health Department. She has a bachelor's in international studies from the University of Oklahoma and a master's in public health from the OU Health Sciences Center. Please join me in welcoming Sara King.
Well, hello. It's nice to see so many familiar faces from days gone by. As Hank mentioned, my former life was as a director of community engagement at the Cleveland County Health Department. At that point, it was region. It was a whole thing. And in preparation for coming today, I thought, you know, the last time I came to you all, I was touring the story of our COVID response and vaccine distribution. And I have to say, I don't know how a public health professional talks coming to speak about public health response for an actual pandemic, but I will try to keep my information today about our new programs at OU interesting and engaging. As Hank mentioned, I got my undergraduate degree from OU, and at that point in time, I thought if they had a public health program as an undergraduate, I would do this whole dual degree with international studies and public health, but they didn't have an undergraduate public health program. So fast forward to a decade later in my career, proud to say that now this undergraduate public and community health program now exists at OU Norman. Our first graduating class actually came, they graduated in 2021, so you can, you know, cross-check that timeline. Public health became a very interesting track for many students through the pandemic and just getting more exposure to epidemiology. What is it to track infectious disease? How does that look from a community engagement standpoint? So we saw really increased cohorts of students moving through our undergraduate program. This was originated really more from a joint venture between the Dodge College of Arts and Sciences from OU Norman and then also the College of Public Health. At that point in time, our dean was the now Vice Provost, Gary Raskob. And I have to say that, you know, they laid such a great foundation for us to now continue building on from a programmatic perspective. I'm sure many of you are familiar with, you know, really from the health science side, we have, you know, we have the med school, we have nursing school, we have some of these dual programs where students start at OU Norman and then they move on to maybe their nursing program at the Health Sciences Center. But our program with public health is really unique in that it's a jointly awarded degree for the most part between both of those two colleges, but really primarily students go through their experience through OU Norman's campus. They get exposure in their coursework, ranging from health policy and ethics to my favorite class to teach is determinants of health, which really looks at more the systems of what impacts our health and our health outcomes as a population. They're able to learn from health data and science to get some biostats in their wheelhouse. I really like to think about or refer to public health education, especially at the College of Public Health, as sort of the Harry Potter houses. Are any of you a fan? Any fellow Gryffindors in the house? And I like to label the different departments. But our undergraduate students really have an opportunity to get to learn from each of these disciplines before they really jump into, maybe continued education or moving on to a specific discipline within public health. We, from the public health practice side, understand that the pipeline of moving forward in expertise is really important. I'm not sure if many of you keep track of what happens or what has happened in the shadow of COVID, in the shadow of some of the budget changes over the years from state and federal government, but our public health entities have lost a lot of public health expertise. We've seen people who have been trained in public health exit because of really a lack of many things that I won't get into right now, but we know that we need to reinforce this expertise. You don't want public professionals who aren't trained in public health at the helm when you have an next pandemic, right? And so we've seen really an increase in these programs, but what I love about what OU has done, really at the leadership of Dr. Ann Pate, now at the undergraduate side, she's the director of our undergraduate program overall, is really a few different ways that we are able to channel students through their interests. So now we have 3 different degrees for undergraduates to choose from. There's a Bachelor of Arts in Community Health, Bachelor of Science in Community Health, and a Bachelor of Public Health, which is really more where my administrative role comes in. You might think, what does any of that mean? Fair question, fair question. So the differences between those Bachelor of Arts, it's gonna be if you're someone who really is more interested in humanities, you're more interested in going on and working on in community engagement or in something that's much more relationship-based in your community with public health, you're gonna probably follow that track. If you're a pre-med student or you're more interested in going into epidemiology, you're probably gonna work on that Bachelor of Science track to get more of those science-based courses alongside your public health courses. The BPH is really unique. BPHs in general are not, there are not as many programs in the United States, primarily because within public health, we have an academic side and a practice side. And that's really come to fruition usually more through our graduate programs. So you can get a Master of Science and go on to do a PhD, more research-based, right? We need researchers out there to understand what our best practice should be. And then we have the practice-based side, and Masters of Public Health, which really is much more one of those applied degrees, to where we're able to take that practice, that best practice from the science, and actually put it into implementation. Well, now we have that designation from an undergraduate side as well. And so those students are able to, through their culminating experience, or what we traditionally call a capstone, funnel back through the College of Public Health, engage in really a mini practicum, which is what our master's students are required to complete, that gives them that real world experience within a public health agency, to then go on and have a BPH degree, allowing them to move into some of these more applied and practical based careers moving forward. Now, what I have seen anecdotally, or just having this program available to students, you know, public health is still a mystery for many people. Outside of the pandemic, it's kind of like, what does that actually mean? What does that entail? Where do you go with a public health degree? And we see students really continue to enter in the university with that same mystery, if you will. But there have been some interesting programmatic moves that we've been able to embark on even just recently. So as of this semester, our Intro to Public Health class now counts as a general education course, which means that now we're able to open our enrollment wider to any student needing a gen ed social science course, which is, you know, a great capture for students. OU programmatically has also changed how they do some of those initial courses for students entering into the university. And so we have a health exposure course that we're able to have some of our faculty attend and teach a couple weeks of classes to give them an overview of what public health looks like, what some of these positions look like, what the science looks like. So we're really starting to see the pipeline move even farther into our younger cohort. And this semester, we've now started to, we saw a little bit of dip after COVID in terms of students or credit hour production, and this semester is our first semester where we've seen that go back up, and it's topped our record numbers of student enrollment and engagement. So the good news is that we have great and lots of opportunities for students. We also have a couple of accelerated programs now that students can, if they decide, oh, I'm really interested in epidemiology, they can now tack on, or really do more of a merger and kind of do that master's in 5 years program with some of our, within these accelerated programs, so with epidemiology or health promotion sciences, these students now can start to switch later on in their undergraduate careers and take these graduate classes, ultimately graduating with their undergraduate degree and their master's at the same time. So we are expectant that students are going to come out of these programs to better serve our communities. Ultimately, you know, the story I was able to sing from my previous tour with Rotaries was to give hope about the public health landscape, and I think this kind of continues to sing that same song. But it's really interesting to see how students digest, and it's really fun to watch them, even within the public health classes themselves, figure out who they want to be within their communities, within their degree program. You know, unlike, something that is much more prescriptive, or, we end up a lot with students who are like, I'm gonna go be a doctor. And they get into some of these public health classes and they think, actually, this is a niche that feels more like me. It makes me feel like I can serve my community, I can help people, and it really broadens their horizons in terms of how even they maybe go on to pursue medicine along with public health. So it's really been an honor to watch some of these students, many of these students, all these students, is that what I should say, go on into their career paths and move toward making a difference in our communities. I like to also say in my position as faculty is that I'm kind of the faculty that gets to be the other duties as assigned faculty. And so part of that also includes some engagement within a different subset of our Department of Health Promotion Sciences, which is the Center for Public Health Practice. So while we have these academic programs going on that are moving on filling these gaps and these needs within the public health workforce, actually out of COVID response and out of identifying some of these gaps that existed during the pandemic, was born the Center for Public Health Practice. And this is actually more of a programmatic piece of the College of Public Health. It is ran by Neil Han. Anyone familiar? Usually when I'm in a room and I say Neil Han, people are like, oh, I know Neil Han. He's the only person I know that's living and has an award named after him. So I think that's pretty remarkable. But we get to follow Neil into battle within various opportunities to match public health practice, public health expertise with what communities are needing. So really what that means was that, we can't rely on the State Department of Health to be all that we need it to be when it comes to community-based planning, when it comes to community-based problem solving. And so the Center for Public Health Practice is able to, along with staff, with me I have Dr. Angela Hardin, who's a project manager with the Center for Public Health Practice, and we get to pair what local communities are doing related to community health planning, community health needs assessments, grants that we have going on, and take that expertise within public health to broaden and bolster the implementation of what we've got going on. Now, what is some of what the center is able to do? I mentioned community health improvement plans, but one of my proudest pieces getting to work with them on our local neighboring county, Potawatomi. Potawatomi County, they have a program called Potawatomi Go. It was born out of a Blue Zones project along with the Avitas Foundation, and they said, we really want to merge all of the local assessments that our organizations are doing to figure out how to better serve our communities. We want to streamline that. We want to go for it together to identify what our communities need and to move forward on problem solving those together. So over the course of the year, they worked with several, I think it was at least 10 different stakeholder organizations to really work on a robust community health needs assessment. To my knowledge, they got at least 4,000 responses, which is the largest sample size I've ever heard of, for sure in the state of Oklahoma, for a community health needs assessment. And from the public health side, the more completed surveys you get, the more accurate your data is related to your sample size. And so now they're in the process of taking what they learned, the priorities that they've set before them, and now working together as a community to really meet and identify how they want to make health improvements within these different areas that they were able to really select out of these assessments. Some of the other opportunities that the center is working on, they have a grant for prostate cancer awareness, so currently working on a campaign to really increase screenings among men for prostate cancer. Will you tell me VTE, but now I'm realizing I don't know what the acronym stands for. Okay, right. Yes, VTE grant. Do you want to talk a little bit about what that is? Yeah, sure.
Yeah, PT is a public awareness grant too for reducing the number of people who die from blood clots. So we're just getting the word out to different populations like public health professionals, healthcare professionals, and just the general public. And because there's a lot of things that can be done and a lot of signs that you can be aware of that would reduce death. And so there's just too many unnecessary ones.
One of my other favorite projects that the center is actually working on, there's a lot of opportunity to partner with OSDH. And so they've partnered with OSDH and they worked on a whole assessment side of looking at the workforce, talking to OSDH employees to figure out where they feel like they have skills required of them that they don't have adequate training in, what training would be helpful for them to feel more confident, more capable in doing their jobs. So we've just finished our first year of implementing really tailored courses for OSDH employees that we tour all over the state. And so that's been really fun to just even have, for me to have that touch point and to be able to take some of my previous community engagement experience, merge it into a course, and be able to then really meet and talk with people across different sectors within OSDH about how we want to build and engage with our communities. So those are just a few pieces of what's going on with the College of Public Health, what's going on with our undergraduate programs. What questions have I left you with? Yes. Well, I saw your hand first.
Okay. Where's the mic? Thank you for that. I heard you talk about assessments and then providing information, and also Sherry Kinney used to be a member. Is she still up there?
She's not. She's actually on my chair for my
Okay.
for my master's.
Yeah, she was a member of our club. So, my simple brain, I hear all that, but what is somebody with a degree in that? What could they actually do as a job? You know, like, what are they doing out there besides assessing and providing information? Is there anything else?
So I have a nifty little list that I've used as my cheat sheet. I would say, to answer your question more honestly, what I've seen happen, especially for some of our undergraduate students who want to go directly into the pipeline, oftentimes they enter into an OSDH role like a community health worker or a health educator that are much more community-based, don't require as much experience, but really still have a value for that public health education. Some of our other students go on into, let me see, what do we have? Some of the specific, sorry. Another low-hanging fruit from the direct pipeline side is as we call it a health inspector, but a public health specialist. Those usually live at the county level, and those are, the people going into the restaurants. So especially if they graduate with that Bachelor of Science degree, they have the science that meets the requirement to become a health inspector. And all of those roles then have elevated opportunities to continue to grow in them. I have seen students go on, especially from the BPH side, use that and pursue something that's much more clinical, whether it's PA or medical based. And that's really been fun to see because we're starting to see, I don't want to say we're starting to see, but there are oftentimes programs that merge an MD and an MPH. We don't currently have one of those programs in the state of Oklahoma, but having a public health education really bolsters that medical degree program. And we've seen medical schools really value what our students are graduating with in terms of some of their experience in communities. Some other opportunities, I think we've had some students go on into, many of them go on to pursue their MPHs, whether at OU or other schools. But I would say primarily, if they're funneling into OSDH, it's usually within a few of those entry-level programs. Does that answer your question?
Yeah, BPH, MPH, would a BPH student go on to get an MPH, or are they getting the background with it? And when would somebody prefer to hire an MPH over a BPH?
That's a great question.
And one last one,
things take?
Let me answer that question first. So we're actually, after this, I have a meeting because we are working on hiring a global health faculty within the undergraduate program. I'm a little bit jealous because I don't yet have a PhD, and I mentioned to our director, I was like, you know, it'd be really cool if we had a global health faculty. So they're making that happen. I can't be it, but I'm happy for the person that we'll select. So that is actually, I think, in motion for the future, is to really start to merge more of that global health track. I think another opportunity that we have that we've recently embarked on is, you know, OU has a great School of International Studies. I'm obviously not biased, but they have, you know, we just had our first year doing a study abroad course over the summer in Arezzo, Italy for a public health course. So there's ways in which they're going to trickle in some of that global health learning within the program. Then I also think that there's a lot of opportunity in terms of merging programs. To answer your first question, so we get that question a lot, and actually, you know, I think the intent of the BPH was to have students go on to pursue an MPH. The MPH is going to be much more specialized. So usually when you get your Master's of Public Health, it's a Master's of Public Health in Epidemiology or in Health Promotion Sciences. That's my background. Master's of Public Health in Environmental Health. The BPH sprinkles in all of those disciplines within their learning, so they don't really specialize just yet. So they would go on to pursue an MPH if they decided they were really interested in studying infectious disease and wanted to pursue an epidemiology degree. I consider an epidemiologist Slytherin. That's just my experience. But that's generally what I think they hoped. Now, what I think actually happens is that the BPH really appeals to students who want to pursue additional education more from a clinical side. So we're seeing some of the students that we initially had going through the BPH track start to go into these accelerated tracks because of their interest in being more specialized. So I think, you know, it'll be interesting to see how these programs grow or how they shift or really who they start to attract based on where these outcomes start to pop up and what they look like. Yes, thank you. That's another pipeline question that I think is, you know, one of those things where I'm like, I think we put the cart before the horse in that arena because, you know, we can programmatically do something at OU, but then it takes a whole other conversation with OSDH, right, to then switch some of these requirements for some of these positions. So when is really more of a question of these BPH positions or the BPH designation or a bachelor's degree in community health are more intended for these early or entry-level positions. Some of these more administrative roles or community-facing roles where you need really someone who can figure out the system and help to meet community needs rather than having some of that more scientific expertise, if that makes sense. Am I answering your question?
All right, one more from back here, and then we'll move forward. You raised your hand. Okay, who else?
Andy knows that.
Sarah, I remember you from years ago.
I was wondering, Andy, I used to love those senior classes at the health
Talking to my students, so during COVID, the college took a pretty firm stand on COVID vaccinations. Can we expect the college to step forward on the vaccination debate going on nationwide?
I think you can expect Dr. Dale Bratzler for sure to take those steps, yes. I mean, I can't speak behalf on the college. What I would expect from the current leadership that we have is that, yes, that the science wins. How prominent that will be, I'm not sure, honestly.
Okay, raise your hand again. I have a question up this way. Okay, Teresa.
What are some of the public health issues that are emerging, and then if there are not people educated in public health, what is the impact on our health as Oklahomans and Americans?
Well, how honest am I able to answer your question? This is going to come from where I teach, right? So the determinants of health and looking at how our systems, our policies go on to impact health. I think we can see, you know, especially to Norman, I don't live in Norman anymore, I really miss it, but homelessness, you know, the homelessness issue is a public health issue. And there are public health methods for addressing homelessness. Now, that being said, we're able to, I'm trying to not say too much and still answer the question. But some of, I think a lot of what's emerging are some of these pieces that are coming out of social policies that have failed Oklahomans. And I think the only way that we turn that tide is to really help students understand how these systems work together to either really, I call them risk regulators, but really create barriers to health or create opportunities for health. Some other pieces that are going to be on the horizon that are already starting to show some impact are access to care, especially from a rural health perspective, whether that's from underfunded resources, changes from budgets, even just changes from the cultural landscape and the legal landscape and seeing more and more providers exit. So these are all creating, issues that are beyond an individual's ability to change. And that's really, I think, the big piece of the pie here. Am I answering your question? Do you have anything you want to add?
No, I'm concerned about mental behavioral health as well.
And that is absolutely, I think, something that I'm loving our program to see. And I will say, Teresa, I'm seeing more and more students enter into public community health with a particular interest in mental and behavioral health. And so that, I think, is, we're figuring out how to integrate that into all of our courses and, for that to be center stage in some ways.
Okay, probably have time for one more, maybe two.
But Joe's question is probably gonna be a lot better than mine. So, mine has really nothing to do with what you're talking about. I'm interested in learning what the size of blood clots are.
Yeah.
Yes, I like that.
All right, now I'm coming up to Joe. Sure.
Do you see a revision in job descriptions that sync up with the rise in undergraduate programs, public health, that accommodate that?
So, we're able to have those conversations easier with organizations who have more autonomy. Now, with the State Department of Health, that's a whole process for approvals that has to go through OMBS. So that's very much in process and delayed. But, organizations like the Oklahoma Hospital Association very much have been more willing to kind of, be more open to undergraduate degrees. So smaller organizations are able to kind of catch that earlier.
Okay, because Nate asked so nicely, we have time for one more.
Okay, thank you, Liz. Nice to see you.
Sarah, really appreciate the presentation. Are there opportunities for organizations and businesses in Norman to engage with the bachelor program to give students an opportunity for those mini practicum?
Absolutely. So I would say first, if you are with anything tangentially related to public health, one, I can absolutely connect you to an opportunity to guest lecture, to talk about your services and your work in the community. But then also from a practicum side, for our undergraduate students going through the BPH as well as our master's students, we require the undergraduates to go through 120 hours of contact for a practicum internship type of experience. For graduate students, it's 240. So if you're at all interested in hosting a student, part of my job, my interest is being able to kind of try to merge maybe something that Virtue Center has going on with a BPH student. So if you have any interest in hosting a student in the future, I'd be more than happy to talk with you and get that set up and start to try to prepare that opportunity. I thought you were going to ask if I wanted to talk about how I knew you, but. So, fun fact about Dr. Herzl is that I was at OSDH while he was still at OSDH, but more interestingly enough, his daughter and I were potluck roommates in college. And we have remained close friends to the point where she introduced me to my husband, and now we live down the street from each other. So, his daughter has been my dear friend and my matchmaker. So thank you all for having me so much.
It's very helpful and informative. I think there might be some interest in having the information that you talked about. So if you want to talk with Stephen at the end and maybe help us facilitate getting that out. Okay, I have one more thing. realize that some of you with red badges might need to go ahead and move to the blue. If for some reason you need a new badge, would you come see me afterwards? We need to put it in order for those. So if you feel like your time's up with the red badge and you're ready to part with it, come talk to me. I do want to thank our guests. Sarah, thank you. Angela, thank you for being here. Sophia, thank you for being here. And Matt. So please feel free to come back anytime and go out and make it a great week.
That's it. Good luck with your decisions.